Hey everybody, welcome back to the Teach Back method, where I teach you guys something I'm learning about in grad school to help me understand it better. For today's video, we are going to be discussing the arthrokinematics at the glenohumeral joint. Let's break it down. Before we dive into the arthrokinematics, I would first like to orient you guys to the models that I have here today. So as you can see, we have a left scapula and a left humerus. It goes like this, and that's what it would look like. Our scapula has plenty of different important components. We have our anterior portion, posterior portion, superior, and inferior. On the scapula, on the posterior side, we have our spine of the scapula that comes out to our acromion. On the superior side, we have our coracoid process. On the outer portion, we have our glenoid fossa. And then, of course, our humerus here. The head of the humerus articulates in the glenoid fossa, making the glenohumeral joint. The first motion we are going to be discussing is shoulder flexion. So, as a reminder, shoulder flexion, or so. How are these components moving together? On the model, we can see here, this is our motion of flexion from the side. So we are talking about what the humeral head is doing and what the glenoid fossa is doing. During flexion, our humeral head is moving superiorly and anteriorly. Let's look at that again. And then to counteract, the glenoid fossa has to be the opposite. So posterior and inferior. The next motion we're going to discuss is shoulder extension. So from a front point, that's where my shoulder is moving, go like this. So on the model when we're doing that, now it's really easy to think extension is opposite from flexion. So our humeral head is moving posterior and inferior, and our glenoid fossa is doing the opposite, so anterior, superior. The next motion we're going to talk about is shoulder abduction, abduction. So from the front and our side. Now, on our model, we have it moving this way, or from a side this way. So, which direction are we moving? We have a superior roll, and to counteract that, an inferior glide. Our next motion is shoulder internal rotation. So, on me, it would look like this. Internal. Now on the model, it's a little bit harder to visualize, but it's going to go almost like this. So, what are we seeing here? We are seeing an anterior roll and a posterior glide. The last motion I'm going to discuss today is shoulder external rotation. So on me, that motion would look like this. On the model, like I said, it's a little bit harder to visualize, so it's going to go like this. Now, we can almost think of it as opposite of internal rotation. So when we have external rotation, we have a posterior roll and then an anterior glide. I would like to point out that with the glenohumeral joint, we have a concave and a convex surface. So which one makes up which? Our humeral head makes up the convex surface, while the glenoid fossa makes up the concave surface. I like to think of a concave surface almost like a cave. So there's a little indentation for the convex portion to go into. And when we have a concave and convex, most of the time we can see opposite motions. So we have anterior superior roll. What's the opposite of that? Posterior inferior glide. Or when we have our abduction, we have a superior roll. What is the opposite of that? Inferior glide. I hope this video helps you understand the arthrokinematics of the glenohumeral joint. Come back to my page to learn more.